The reason we are doing this is because every day folks are dealing with new pain that doesn't go away.
Pain's a difficult thing to understand. So let people know what kind of options they have.
All right, Dr. Powers. So good to see you again for our second podcast. Again, this is Dr. Scott Glazer, Dr. Sean Powers, coming to you from the pain specialist of Greater Chicago here in Burr Ridge, which is a suburb of Chicago.
Welcome to the Pain Podcast again.
Yes, welcome. And today what we kind of want to do is just drill down why humans have pain and how pain can become chronic in some patients and why. And we just want to define for the people listening to this, why do we even have pain? Why do human beings feel pain, Dr. Powers?
Yeah. I mean, pain at its purest form is a healthy response to let us know that our body, that there's danger. Basically, is kind of
exactly
how. I mean, that's why we were given that sensation, because it helps us stay alive, helps us survive.
It's protective.
It can be protective, yeah, and that's when we're talking about acute pain. So I guess that goes along with, the how do we classify pain?
Yeah.
When you and I think about pain, we try to categorize it. That helps us figure out what's going on.
Yeah, and really the temporal time, the temporal nature of the pain. I mean, if we see a patient who just injured their lower back yesterday, and they're miserable today, is this acute pain that's going to go away, or is it acute pain that's going to transition to subacute pain? We'll talk about that. Or is it something that might end up being chronic pain? And it all depends on what tissues were injured in the lower back. And we don't know that when we meet somebody right after they're hurt. Obviously, if somebody cuts themselves, that's painful. And usually, in most healthy people, those cuts will heal with time because of the actions of stem cells that come in through the bloodstream. And the healing process, the inflammation is actually the start of healing. These stem cells come in and start remodeling and healing the where the cut was in your arm, and you don't develop a subacute or chronic pain from a cut typically. Whereas when you injure other structures, such as cartilage in a joint, it might not get better the way you would expect a cut to do. And so when we talk about subacute pain, that's a person whose pain is lasting longer than you expect. It's not the arc of the pain, the graphing of the pain is not dropping down as fast as you'd expect. It's going down, but you don't know what's going to happen. Is it going to plateau? Are they going to develop chronic pain, or is it going to go down until it goes away? You want to talk about subacute pain a little bit?
Yeah, and I think you hit on the important part, that acute pain typically is related to some type of tissue damage. So you talk about cutting your arm, you talk about maybe hurting your back, and then we want to know what's the normal time course for something to heal. And that can vary. It really varies depending on the injury. I would say it's something that you kind of base it off of the person and the injury itself. So there's not always a perfect timeline to these things,
There isn't. But for pain to go away, it's got to keep going down.
It's got to keep going down.
And
so
this is when it stops going down, that's when we get worried.
Yep.
That's the transition time. Is it going to go, it's not going down anymore. Is it going to become chronic? And it really, when you first meet somebody, we don't know, again, going back to the back, if they injured a muscle or a tendon, they might get better because that gets more blood flow, like the skin does. Whereas if they injured cartilage in a facet joint or the annulus, which is the fibrous tissue that holds the disc in, sometimes these structures don't ever heal because cartilage, as we were talking about earlier, you need stem cells to heal. So the action of stem cells, which has to get there through the bloodstream, is to heal. But if your cartilage injury is too severe, as you mentioned, the severity of the injury is so important. If it's a critical injury, I think that's a word is used to describe it. If it's a critical injury to cartilage, it never gets better because there's just not enough stem cells get in there and fix it, and then you have a chronic pain syndrome. And that one of the most common. Most of the people listening to this podcast probably will be suffering neck or back pain because that is the most common chronic pain, and that's actually cartilage pain, cartilage in the joints of the spine. All these bones touch each other at 3 different joints, the disc joint and the 2 facet joints. And so the pain that you suffer when you have back pain is no different than if you injured your knee. It's a cartilaginous structure. The problem with the spine is that these joints are so close to nerves that you can end up developing other pain syndromes, sciatica, pain going down your leg because of a injured disc or injured facet joint irritating the nerve. But that's the only difference between back pain and knee pain, really.
Yeah. And then what you were touching on too, we can define acute pain, we can define chronic pain, and subacute pain, for lack of a better definition, is what's between acute and chronic pain. And it's it's kind of that. I would say that's the point where we can really intervene and try to prevent this from turning into a chronic pain, because we could see you're not getting better how we think you should be getting better. Can we act on this early enough to try to prevent chronic pain?
Well, and what you just said was perfect. It's important to see a pain specialist at that point, because there are too many physicians that the old way to treat pain before there were pain specialists is, hope it goes away, give some meds while you're hoping it goes away, do therapy while you hope it goes away. And if it doesn't go away, if it's bad, give them opioids, maybe send them to surgery. This is why we invented our specialty. We don't want patients to be started on opioids early unless absolutely necessary. Mm-hmm. We don't want patients having surgery for subacute pain or pain that's becoming chronic unless absolutely necessary. But people get desperate, and that's what's happened over the years. Is people develop a painful syndrome. They aren't able to see somebody in our position that can do a minimally invasive treatment of the cause of pain. And they do get started on opioids by possibly their primary care doctor or maybe the emergency room. And some of them get desperate and go to a surgeon. The first specialist they see is not a pain physician, but a surgeon.
Yeah.
And so they start to think of surgery as an appropriate, first treatment, when surgery, because of the risk-benefit ratio, with the risks, which we'll discuss in other podcasts, are so high, it should be saved for last.
Yeah. In when you have that injury and you're in pain, and a lot of it is symptom management at first with medications. It's not necessarily treating the actual root cause of your pain. So that's where kind of our field comes in, where we look at what is causing your pain and how can we do a targeted treatment for that pain to prevent you from needing to require things like Band-Aids, things like medications long term that maybe are covering up some of your pain, but maybe not addressing the root cause. So that's where we can come in and we can really try to zap this pain.
No, for lack of a better word, it's true though. When you do these injections, it is zapping the pain. It's pretty remarkable how people can get better with an injection. But the Band-Aids aren't all bad. I mean, when somebody's just injured, not sure if it's going to become a subacute or chronic situation. We will give patients Band-Aids just to get them through time-wise to find out. Yeah. We just don't want any of those. We don't want to give them dangerous Band-Aids like opioids.
Yeah.
And again, that's a whole subject of a whole nother podcast.
Yeah. So, if we break it down, acute pain, we think that, this pain should improve. When it doesn't improve in a reasonable amount of time that we would expect, that's when we, may call that subacute pain. Chronic pain, if we're looking at strict definitions of that, you're looking for something that's been around for about 3 to 6 months, or it's past the time where you would naturally expect that pain to improve. So that's where we start to call that chronic pain.
Well, and that's mostly the definitions of most national organizations, but after doing this for 30 years, to me, it's easier to say chronic pain is when when you stop improving. As soon as you stop improving, it could be day 6 or day 30. As soon as the pain is not improving, you're transitioning into chronic pain. That's Dr. Glazer's personal definition. But I treat a lot of patients who are injured in car accidents, and we will treat them minimally invasively with procedures as soon as their pain plateaus. So basically, that's the definition in my mind, and that's a more humane definition. You're not going to make a person wait months with the same amount of pain before you call it chronic. You know what I'm saying?
Yeah.
So I'm not going to quibble with you about that. I'm just saying, for the person suffering the pain, as soon as the recovery has plateaued and not gone to complete recovery, that's chronic.
Yeah.
I think that's actually the best definition.
Yeah. That kind of follows like the IASP definition of pain too. So yeah.
There's so many organizations involved in defining pain.
IASP is a very large pain organization. Yeah, just for our viewers, something that we reference when we're looking for definitions of things.
Exactly.
All right. Well, that's kind of the chronicity type of pain. Maybe in the next episode we'll touch on the different types of pain itself.
Yes, we were actually thinking about doing that now, but because that's so important. But because the vast majority of patients we see do suffer musculoskeletal pain from joints, and mostly pain from the spine because there's so many joints to injure in the spine. We wanted to kind of get that out of the way, but we will be doing podcasts on different types of pain: neuropathic pain, visceral pain. Not everybody suffers pain in the spine. We have patients with every type of pain imaginable, right?
Yeah. It's your spine pain, joint pain tends to be what we see most. That tends to be what what people are seeking help for. So that's going to be one of the first things that we touch on. It's going to be those more common complaints.
Perfect.
Yeah. All right. Well, thanks, Dr. Glazer. Thanks everyone for listening. We'll see you in the next episode then.
Thanks a lot. Thanks, Dr. Powers.